5 more people have died from COVID-19 in Grant County, bringing the total number of deaths there to 125. And one of the 5 who died was a Moses Lake man who was only in his 20s.
Grant County has a higher death rate than Spokane County, and it has one of the lowest vaccination rates in the entire state. KREM 2's Casey Decker spoke with health officials there about the challenges they're now facing and how they're working to overcome them.
5 deaths may not seem like a lot on face value, but in a smaller county like Grant, those carry a lot of weight.
Every death is pretty impactful in our community, particularly when we look at those ages. It's a wide range of ages. So, I know that the community might be a little bit numb to it, but with each death, there's a story behind that person in that case.
Especially alarming the 20-something who died. A reminder that although the virus is typically more damaging with older adults, its real impact can seem truly random.
We see some young folks with very mild symptoms. We see some folks that have fevers for 7 days straight. And you don't know if you'll be that person that ends up just being wiped out by it, or if you'll be one of those mild cases.
The best way to combat that randomness, of course, is the vaccine. But Grant County is lagging in that area. Only 27% of the population is fully immunized, compared to 37% statewide. Lena Mitchell with the health district says one reason, demographics. Grant County leans younger and has lots of people who only recently became eligible. But another reason, vaccine hesitancy.
We have pockets of the community where they're not anti-vaxxers. They do believe in vaccines. They vaccinated their kids to get into school. They vaccinated themselves. They might get a flu shot every year. But somewhere along the way, there was some piece of information about the COVID-19 vaccine that just jarred them. And so we're working on acknowledging that, legitimizing their concern, and hopefully meeting them where they're at with appropriate information and education.
There are also lots of agricultural workers, making up nearly a quarter of Grant County's jobs, and a lot of people whose first language is not English. More than a third speak another language at home. Both are groups who may not have easy access to healthcare and so therefore to the vaccine. That's why the health district is running pop-up clinics across the county.
Areas where they might be underserved with medical care, or areas where we know that they might not seek out care, they might not have a primary care provider. So with taking our team to that specific site or that workplace, we're hopefully making it more accessible to them.
Casey Decker, KREM 2 News.